Good afternoon. It's good to see everyone on this Wednesday afternoon. You are here for our third installment of our Better Together series, and we have several wonderful departments represented today. So they're going to give you lots of great information. We're going to try to hold the questions until the end, if possible. We'll do some Q&A with all of them. And of course, if the fire alarm sounds, please remain seated and we'll direct you to an elevator or stairs in an orderly fashion, and we'll go to a red pole. But again, thank you for being here. We're going to start with the Stewart Health Center, and we have Debbie Savinsky.
Thank you, everybody. We so appreciate you making the effort to come out today, and it's a privilege that we can speak to you and just give you some more information and some more knowledge about the health center. So someone mentioned it's nice to have the information. Sometimes we have kind of that fear of the unknown because we have never been over to that area, or we don't know much about it. So we want to relieve your mind and let you know you've got an awesome group of people over in the health center that are ready and willing and very capable to take care of you should you need that. So just welcome to the health center. And then a little bit of information. We've got, again, several speakers, so we'll try to go through so we don't put you to sleep, and that you have opportunity to ask some questions as well toward the end. So if you can think of a question that you need, just kind of tuck it behind, and toward the end of the session is when we'll take those questions. So my name is Debbie Savinsky, and I'm the Director of Nursing here at Springmore, and I have been here 26 years. So I'm very committed and dedicated to you all. I started when I was 3, so that's why. My husband is Scott, and we have been married 27 years. I met him when I was 18. And we have 3 wonderful children, Sean, Cole, and Reed, all boys, and that's why I dye my hair. And they are wonderful, and I enjoy so much being mom. That's job number 1. But I'm very privileged to be here at Springmore, so thank you all again for letting us be here at Springmore to serve you. So the first piece I'm just going to talk about a little bit is what to expect when you come to the health center. Again, you have a big team that helps you. It's not just nursing. We have housekeepers. Boy, if they didn't clean, we'd be in a pickle, wouldn't we be? We have housekeepers, we have dining staff, we have your therapy staff, we have your physician, we have the clinic that helps us out too, we've got podiatry, we've got a whole team of people that are coming alongside you to help you to improve and get better. We also, our goal always is to keep you as independent as possible. Most everybody in this room moved to Springmore so that you know that you have your needs met should ever you need health issues covered. But of course, you all want to stay in your lovely apartments and your homes, and the goal is to not go into a skilled facility. However, you also are very wise that you have understood that should you need that, as you are getting older in years and our bodies just kind of fail us and we need more help. So the goal always is to keep you as independent as possible, and that's what we do when you're coming into the health center. We're looking to help you get back to your apartment and to your home. So we don't have a key that we're going to lock you up and you can't ever get out. We want you to be able to get home. However, we also want you to be safe at home. And sometimes it takes a little time for us to evaluate your situation and see where you're at and make sure that you're safe at home. Sometimes that just involves changing medications. Sometimes that just involves adding in some home care, that we have an awesome home care team right here at Springmore that can do that for you. Maybe you need just some help in your home. But there are several things that we're going to look at when you come into the health center to make sure that you're going home safely. Sometimes you do need to stay in the health center. Sometimes you do need to have a longer rehab time. So just bear with the team when you're there in the health center to know the goal is to get you home, but also we need to keep you safe. And then also, you've got a personalized care plan, so nobody's cookie cutter. Some things are cookie cutter, like we don't want anyone to have a fall and an injury, but everybody is specific. So the nursing team builds a care plan just for you that involves the doctor, the physician, dietary, our dietitians, everybody is looking at your particular case. What brought you into the health center? What needs to be resolved or helped so that we can get you home? That word care plan is something that sometimes you might not realize what's happening behind the scenes, but those are implemented from the physician and then from the nursing standpoint to help you get better. And there is a formalized meeting within 14 days of admission that they will go over with you so that you know and you're able to participate, because we want you to be able to participate in your care and your choices as well. When you're in the health center, you've got a nurse and you've got a CNA, a certified nursing assistant, that is committed to your care every shift. Now, you do have to understand, a CNA is not, a certified nursing assistant is not one-on-one care. So if you want one-on-one care, again, we have an awesome home care that's able to provide that for you. But the CNA is going to have about 7 or 8 residents. So if you think in a day's time, 8 hours of care, and I've got 8 patients, that means I have 1 hour per patient for my shift. But you also have to take out the meal time and a shower time. And so you understand that the time is less for a patient. You're not looking at a one-on-one care, but we do provide all kinds of help with your ADLs, the activities of daily living, such as getting dressed. Maybe you've hurt your shoulder, and there's no way that you're going to be able to get your bra on or get your arm through a sling or get your shirt on or button anything. And the CNA is coming alongside you to help you to make sure that you're ready for the day. You can participate in all kinds of activities then, but they're going to help you get to the restroom. They're going to help you get in and out of your bed, all those type things. You might not need all of that, but those are the care that they're providing and they're looking to do to help you to make sure that you have the care that you need so we can get you better. So what to bring? You want to bring your medications into the health center. We can't take over-the-counter medicines such as Tylenol or a vitamin or a calcium, but you can take your medications into the health center as long as it's in a prescription bottle and has your name on it. So let's say you take Lasix, a diuretic, and it has your name on there and what you're taking, and you haven't mixed all your pills in there. It's just that medicine. We can take that. I know prescriptions can be expensive, and we're trying to help accommodate that as well. We can take that up to 30 days. Medications that you don't want to take would be a narcotic. If you're coming from the hospital and they've ordered you something, please don't get it filled there. We will get it here. And that's just a regulatory thing. We need to get the medication from the health center pharmacy. So just so you're aware of a narcotic. And then a lot of people, we live with our phones it's like an extra appendage. So, bring your phone charger so that you have a way to communicate with your family. Of course, we have landline as well, but a lot of people ask for that, or their tablet, a reading material, something like that they would like. Rehab's you're going to get your money's worth with rehab. They're going to work you hard. So make sure that you're bringing good shoes so that we can participate in that therapy and get you better and stronger. And then your toiletries, of course, just like a hotel. We've got toothpaste and a razor and all those things should you need it. But a lot of people like their own items. So some guys like their razors or whatever they want. So bring those type things that you would wish to have. You don't have to sit in a gown. You can bring your own comfy pajamas or your robe or whatever you would like, a change of clothes that you would like as well. So you're aware of that. Discharging, and again, we're trying to get you home safely. So it is a team approach, and you're involved with that as well. It's not a singular decision. We're looking at a lot of objective material too, therapy, dietary, nursing, physician, everybody together looking to see what is going on with your care, that you're back to your baseline where we can get you home, or are there things we need to add in to keep you safe, or is it time where you need to come to the health center? So we're looking at all those pieces, and again, you're involved in those decisions, and your family is as well too. And then I just put it doesn't really fit on this slide, but the physician, just to give you an FYI, a physician, Dr. Patel, will see you within 5 days of admission. So if you come in on a Friday, He's going to see you, within about that 5-day window is when we want. Regulatory-wise, a physician has to see you within 30 days. But we have an awesome concierge doctor here that helps with that, and we want y'all to be seen promptly. And so it's within 5 days. After that time, you can see a nurse practitioner. Anne is here with us. But the original first visit is with our physician. And then when you're ready to discharge, typically Ms. Anne helps us with that, just so you're aware of that. There's a formalized process because we want to make sure you have your medications to go home, you have therapy lined up, anything that you're going to need. We want it to be a smooth transaction so that you're set up for success when you're going back home. And then just a comment, health needs after hours. Some people might have, maybe you have tingling in your arm, maybe you have a terrible cough, and of course it's Friday, the clinic has closed, and now it's 8:30 at night. And you're like, I probably should have called at 4:30, but I thought it would be okay. So now that it's 8:30 at night and I feel really lousy, please don't feel that you're ever bothering anybody. You just dial 0. And we have a nurse there, a supervisor that's going to come to your home, and they're going to check you out and take care of you. If you feel okay, you can come over to the clinic area and they'll get your blood pressure or whatever you're needing. But if you don't feel well, please call. You've got care here around the clock. So you're not bothering anybody. Everybody is up and awake, and they're taking care of you. So if you have questions or concerns or problems, don't feel that you have to wait till Monday morning when the clinic opens. If you don't feel good on Saturday night, call somebody, okay? And you call 0. That's the easiest way. Some people might have a pendant. You can push your pendant. But just to be assured that you've got help and someone's going to come and take care of you, they'll look at it and see, is it something where you just need some reassurance and everything's okay? Or do you need to go to the ER? And they're going to handle all of that for you, so just so you're aware. And that is all I have. Thank you so much.
Hi, good afternoon, everyone. Can you hear me? Okay. My name is Steve Mistretta. I'm a social worker here in the health center. I've been here a little over 11 years, and I'm your support. I'm going to be giving you updates weekly, and if you come into the health center, and helping you with that adjustment and finding your way and understanding what needs to, if you need to talk to somebody to find out some information, I could help you with that. When you come from, if you come from, you could either come to the health center from your apartment through the clinic, that's one way, or if you're at the hospital, I'm communicating to the hospital discharge planner, and we're planning your admission to the health center. So we do that in advance. And sometimes we have folks that move into the health center permanently, so if they need long-term care, and sometimes we're able to do that in advance with families, and I'll meet with them, and we'll have conversation about their expectations and what we room availability, and we'll discuss what we're going to be helping you with. So yeah, I work with the nurses. I work with the doctor, with the nurse practitioner, and the therapist. And on Tuesdays, we get an update. I get an update about your progress. So if you come into the health center and you're receiving therapy and skilled nursing care, every Tuesday I'll get an update, and then I'll come to you and I'll talk to you and or your family. I could call them, and we'll talk about what your goals are and where you are at that time with your improvement, because we want to get you home. We're not trying to restrain you. I'm not trying to recruit people to stay permanently in the health center. Our goal is always to have you go back home, if possible. if that's with some extra support, we could help you get that. The therapists are going to do a home safety evaluation towards the end of your stay, and so they'll to determine if there's anything else at home that you need some changes with, or any, what kind of support you might need, and then we'll plan for you to go home. So we already talked about that. Going home, if you're in the health center and you're going home, you could have 5 days of meal delivery, and there's no charge for that. So that'll be on your discharge paperwork when you leave the health center. And if needed, we'll set up outpatient rehab with Trinity. So those of you that move into the health center, into your apartments, you come to us and you get 30 eligible days in the Stewart Health Center. And each January, you get another 30 days. So if you, let's say, for instance, you don't use your 30 days for 3 years, the max you can have is 90. But so if you use 15 days this year, you'll get 30 next year, so that'll be 45 you'll have, and then so it keeps accruing. And for some folks that come in and they don't have that many eligible days, there is a short-term stay fee, and I'll let you know what that is. When you come in, it's just for the room rate, and so we want to personalize your care. It's independent. We have care plans every 2 weeks, and so when I talk to you, I have an assessment. So I'm getting to know you, trying to find out what you normally do at home and what changes have happened, and to share that with the team, so we could, get you home independent, and it helps us to really connect with you too, because we all have families too, and I kind of feel like, what's good for my mom and dad is good for you too. So I'm going to be advocating for you just like I would my own family. We do have a complaint policy, so if there's any, I want to know, if, whatever it might be, if you feel uncomfortable, or if there's something that we can improve. I was talking to somebody today, and their mattress is lumpy. So I said, I put a work order in to change that mattress. It's so no small thing. There's no small thing, because it's not home, and I know you'd rather be home, but we want to make you feel as comfortable as you can be. So, and I'll help you to do that. We talked about the care plan meetings. I also might talk to you about advanced directives. There's a MOST form that many of you have, maybe a copy on your refrigerator. Sometimes in the health center, if we don't have one on file, I'll come and talk to you to work on another copy. And my number is up here, and my email address. And, please call me if you have any questions. If you do have any procedures coming up in the future, you could reach out to me and we could talk about that. And I could, put you on our schedule to plan for your admission. All right, thank you very much.
Steve, you're a little taller than me. Can everybody hear me? Am I speaking loud enough? Okay. My name is Amanda Wetzel. I'm the Healthcare Services Manager and your facility long-term insurance representative. I've been here for 17 years. Go right here. So some of the services that I can help you with primarily with long-term insurance is reviewing your policy, helping you see what services we offer that would go along with your policy. I'm able to help be kind of a third person with you when you open your claim. I can help you from start to finish. In between that, I handle most of the records to help support your claim. And then depending on what kind of services you have, I can help with the submissions for monthly reimbursement for you. I can also assist with premium increases and election letters if you choose to change your benefits or whether you're increasing or decreasing your benefits. I help in a lot of other areas. It's just kind of more based off of your policy and how I can meet your needs. I know you've had these policies for quite a long time, and I want to make sure that you get what you have paid for. Really, mine's not that long. I don't know what else. Ready? Okay. Thank you.
Hello, my name is Donna McGee. I am in charge of the Springmore Insurance Department. I like to start off by telling everybody that it is a voluntary service. Nobody is forced to use it. You don't have to if you don't want to, but there's no charge for the service. It's already included, so if it's something that sounds interesting, might as well, right? So basically the first thing people want to know about our services is what exactly do we handle? We will handle any of your primary doctors, your specialists, your cardiologist, neurologist, PT, OT, ST, vision, and podiatry, anything like that. Anything that is going to take your Medicare or your Medicare Advantage plan, we will usually handle it. However, there are some that we do not handle. We do not handle long-term insurance or life insurance. We have Amanda who does long-term insurance, and she does it quite well, so we don't try to step on her toes. Number two, we don't handle dental. I guess when the system first started, there wasn't a whole lot of people that had a dental plan, so it was not built into our system, so we do not handle dental. We do not handle prescriptions. Prescriptions are very, very different with every provider, everything makes a difference with prescriptions. It's just not something that we can do a deep dive into. We don't do renter's insurance. I get that a lot. We don't do car insurance. I get that a lot too. We don't actually help choose your new insurance carriers. I know it's open enrollment and people are constantly asking who do I think is the best one? Well, I can tell you who pays the best, but who pays the best may not be the best for you because every single one of you are on different medications and I don't have a list of how much each thing costs. I would do you a disservice if I were to try to tell you what kind of insurance to get. Any of these things that are listed that we do not handle does not mean that you can't come and talk to us about it. We will do the best we can. We will look things up. We will talk about it. We will tell you everything we know about it. We will do everything we can, but it just means that we're not going to make those payments for you. So now we have a list of things that we have to do our job effectively, and then I'll tell you what our job is. I love going backwards. So number one thing that I always tell everybody is let your family know if you choose to use Springmore Insurance, and you'll figure that out in just a few minutes why, but it's very important that you let your family or your loved ones know that you're using us. We would hope that you would always provide us with an updated insurance card. It's pretty important. If you get denied and we have the wrong insurance card, then we're not going to be very helpful. Give us a copy of any bill that you receive from medical providers because we can't help you pay something that we don't know about. And most important of all, turn in all your explanation of benefits from your carriers, and that's any paperwork that comes from Medicare, Humana, Medicare Advantage, Blue Cross Blue Shield, Aetna, any of those providers that, I know I missed somebody, any of those providers that you may have, the carriers that you may have, just turn those all in. Now, exactly what do we do? I was very, very nervous coming up here because I'm not a great public speaker, but then I looked around and I realized I know a lot of y'all. A lot of you guys already use our services, and so the biggest thing I would say is ask somebody if they've ever used our services and ask them how they feel about it. Ask them if it's something that they would recommend or not. We use your explanation of benefits that you give us each month to make sure that your insurance has been filed. If you go to the doctor and you give us a bill, let's say you give us a bill from Rex, we're going to look at your Medicare first to make sure that your Medicare was filed. And then if you have a secondary Blue Cross Blue Shield, then we're going to look at that as well to make sure that that was filed. If at any point something gets skipped, we're going to give them a call and make sure that they're charging you the right amount. We're going to follow up with your carriers or your providers, depending on which it is, and say, hey, I think maybe you have the wrong insurance information. Or we may say, I had somebody in my office this past week that for some reason her secondary insurance wasn't being filed at all. So I gave them a quick call. These are things that you're not going to have to do. And hopefully in the end, that's going to save this particular person $153. I think that's about it. We're also going to fax updated insurance cards to providers when needed. That's the reason that we need that updated card. So Springmore Insurance can give you a list of all the bills that you've paid out of pocket. This can actually be helpful at the beginning of the year for tax purposes. We'll give you a list that says that you paid $20 to Raleigh Medical Group on January the 2nd. You paid $20 to the podiatrist on February the 2nd. It will break everything down for you so that you can use it for taxes. You can also get this list at any time if you're just wondering what's going on with your account and how much you've been paying. Sometimes it's really interesting if you're trying to figure out, I really feel like I've paid a lot in PT or speech or something. You can, and you're using our services, you can just get that printed out and you can see how much you've paid. We also keep a record of all the specific bills that have been paid. You don't have to worry about paying those duplicate bills. Sometimes you get billed 2 to 3 times, especially, I'm just going to give you the good with the bad. Especially if you're using our services, you're going to get a second bill. Because we're going to wait to make sure that that is checked out before we pay it. So you're always going to get a second bill. But no matter what, just remember that we're double checking to make sure that that particular bill is not paid a second time. We also keep a copy of all of your insurance information on file on Springmore premises for 7 years. After that, we shred everything safely. How it works. You're going to give us the bill. You're going to give us your explanation of benefits, whether it's Medicare or an Advantage plan. We're going to compare the two to make sure that they match. If they don't match, we're going to give people a call, and we're going to make sure that in the end, it is what it should be. And the more we know, the more we see of your account, the more I can look at you and say, hey, Alex, I know what your insurance should pay. Hey, Marianne, I know what your insurance should pay. I know how much you should be billed for this. Then Springmore is actually going to make that payment on your behalf. This is where it gets important for your family members to know that you're using our services, because we don't want your family members to be paying the same bills that we're paying, because then the doctors are very happy. After we pay, then we're going to bill you, and you can repay the amount of the bill. We don't charge anything extra. We're not charging a 5-cent surcharge or anything like that. But we will bill you that amount. You can either choose to pay us by check, or we can put it on your monthly bill. That is up to you. Why do we do it this way? Good question. It's always good to have an extra set of eyes looking over your information. Insurance can be very confusing, And so it's nice to have someone extra look. There's always this one place. If you give us everything, we keep it in one place and everybody can check it. If for some reason you go to the health center and you have left your son in charge of your finances, which I'm going to say may or may not be a good idea, but your son knows that you use Springmore Insurance and he automatically is going to know to bring me your bills and to bring me your explanation of benefits. And that way you know there's no change. Everything is going to keep going. We're going to keep paying. You don't have to worry about him accidentally paying something twice or him forgetting. And you don't have to remember whether or not a bill was paid. I'm constantly getting people that say, I really thought I paid this bill. But all the UNC bills look alike. Every single one of them. They all have the same colors, and half the time they have the same doctors on it, and time goes very fast now. So if you hand it over to us, then we can help double check that again to make sure you're not paying that same bill twice. Thank you.
All right. Good afternoon, everybody. Hi, I see a couple familiar faces. I'm Haley. I am the consultant pharmacist and the on-site pharmacist here at Springmore. I've been here, well, the on-site pharmacy's been here about a year at the end of this month, but I have been the consultant pharmacist in the health center for about 6 years now. Today, I'm specifically going to speak on the on-site pharmacy. So we kind of, in conjunction with Springmore, discovered, it might be a good idea that everything to be here, you start losing mobility, and give people the options of you can get your prescription medications right here on site. You don't want to go out and about, or if you go to the clinic and you need an antibiotic, you're sick and you need it right away, well, you can just walk right down the hallway. So this is a venture that Neal Medical Group is the pharmacy, but the site name is PharmSave Raleigh, so I know that can get confusing, but we did a venture with Springmore, and we're very excited they allowed us to do that here. So people always ask, where are you? So I have a nice little map. If you know where the clinic is, well, to start off, the health center entrance, if you enter through there, you have the clinic, which you see there in the bluish, purplish, depending on how you look at it. Right down the hallway is the pharmacy, and the receptionist is able to help you, direct you if you need that. We are open Monday and Thursday, 9 to 4, Tuesday, Wednesday, Friday, 9 to 12, so essentially every morning. I have my phone number there for you guys. And there is a Springmore extension, so you have 2 different ways to give me a call. Services available. So we do vaccinations. A lot of you, we had our vaccination clinic. You could get your flu and your COVID earlier October. Some of you have come, if you could not attend that, to the pharmacy, so we can give you your flu, COVID, pneumonia, shingles, RSV, tetanus. You're able to get those here and without having to go out to your doctor's office, or if you can't get an appointment at CVS, Walgreens, Walmart, we are more than happy to help assist with that. You can refill your prescriptions. We are a full-fledged retail pharmacy. I know there are many people who have their pharmacist that they love and their pharmacy they've been going to for years. That is perfectly fine, but it is an option here for you guys if you just have found it's harder to get out there, or they're just not, you feel your needs are a little bit differently at this time. We have competitive pricing. We are contracted with most insurances, and we are more than happy to do a test script for you to make sure that your copay or the price would stay similar, or be sometimes some insurances, because we are not like a CVS, Walmart, Walgreens. We're more of a independent boutique pharmacy. It might be a couple bucks more on your copay. But we are able to do for most competitive pricing and the 90-day fills for you as well. The pickup while at work, employees are able to use the pharmacy, just so you guys know. So if you do see some staff there, they are able to utilize us as well. We also supply over-the-counter medications. So again, let's just say you're not feeling the best and you can't get out and about to go and get those medications. They are able to, you are able to get those at the pharmacy. We carry your allergy, pain, cold and flu, your vitamins, and we have more available. We have really tried to tailor this pharmacy to meet your needs here in the community. So if there's this particular over-the-counter medication that I don't have and you do want to get it from me and continue utilizing it, I can make sure that that is in stock for you. And our pricing is pretty competitive with those two. Right here I have some photos. As you see, it's not a giant over-the-counter section, but we have your general, what you would normally get at any other pharmacy. When I say it's competitive, you can get Tylenol, 100 count for $1.98. You can get some regular Claritin 100 tablets for $4. So we try to make sure it's very cost efficient for you guys. So kind of going back to that, why to use us? Let's just say, like I was talking about, you like your pharmacist, you like your pharmacy you're at. You can come and call me or ask me questions at any time. If it's just any medication, we're here for you guys. You don't have to fill your medicines there or pick up a prescription or get a vaccine. We're also there for a resource for you guys. If you have a question of, I started this new medicine, I'm having this what I think might be a side effect, is this from this medicine? Or I went to my doctor's office and he said or she said that I was experiencing this, I might want to consider starting this medication. What are your thoughts? Or what, we're here for you for that, the pharmacy staff, and we'll try to help you guys. I've had people bring their medications and we've kind of just discussed what they're for. A lot of times individuals can't remember why or aren't certain why this medication was started or if they should or should not continue. So we're able to evaluate your medications and kind of talk to you about why you might be on them and kind of get you a starting point for, hey, next time I go to the doctor's office, maybe ask them, this is what this medicine's for, do I really still need it? Or give you guys some peace of mind for why you're on this. So you don't, while I would love to see you all the time with your scripts, we are truly here to meet your needs. A lot of people ask, what are our pickup options if you do use us? So you can just come to the pharmacy during normal business hours. We do accept credit and debit cards. However, if you are somebody who enjoys having a bill at the end of the month, you're going to use Miss Donna's little insurance. So you can, we will bill you at the end of the month for a statement is what we call it. And you do have options to bring me a check, or you can set up with the pharmacy automatic payment are your options as well. We do also offer delivery on Mondays and Thursdays. There is an individual who will deliver between the hours of 3 and 4. So if, and she's lovely, Landy is her name right now, and she will bring it to your home. If you have another appointment or you're not going to be there, we do have it set up. You just sign a little waiver saying that, yes, you were notified. It's just one time, but she will unlock your home and just put the bag on the inside of your door and then lock your home back up for safety purposes. But that's just to ensure, hey, you don't have to be in your apartment every Monday and Thursday between 3 and 4 to accomplish that. So that's what the pharmacy looks like on the outside. It is just to let everybody know. So where can I send my scripts to? So Farm Save Raleigh, that's the name right there. The address is 1500 Sawmill Road, so it is the Springmore address here. Sometimes your provider, especially the outside providers, might have to look up the address to find us, but I included all that information for you guys. If you utilize the clinic providers, they are very easy to, very quick to get us your medication orders as well. So let's just say I am interested in switching pharmacies. Like I said, we can check pricing for you before all that occurs, but we as the pharmacy staff will make sure all your medications are transferred from your previous pharmacy. So you don't have to do any of the legwork. We make sure your prescriptions are transferred over. We get them in our system. We double check all the drug interactions and just make sure you are good to go. There you go.
Any questions?
Thank you. I have a question for Debbie. We have a private physician. How does this interact with the healthcare center?
That's a great question. Thank you. So when you come into the health center, you would be under Dr. Patel and his care. And then when you go back to your apartment, you would transfer care back to your physician. So we do have a few physicians, there's 2 currently, that are able to have concierge services in the health center. So there is paperwork that they would have to complete. There's training on our EMAR system, which is how we chart and enter medications and such. And so if your physician would like to have privileges to come to Springmore to see you, we can do that, but there would be a series of things that would need to happen first, and I would need his licensure and things like that. So typically, most residents just go ahead, unless they're going to, usually you're just there for a short time. If you were going to be there a long time purpose and you wanted a different physician, you could do that. I could give you a list of the couple that come, or you could see if your physician would want to come to Springmore. Yes, ma'am.
I have a question for you too. I was in the health center a couple of years ago, and bringing my own pill bottles was not even a question. I could not do it. I mean, I didn't. So I wound up with a ton of pills at the end of the tenure. Plus, there was no consultation on, yes, I have prescriptions for things, but I don't necessarily take them daily or monthly, or I have them on call with my own, and I have my own physician as well. And so I wound up with all these pills I really didn't need either. How does one, and I have a POC for health reasons, so, they could be consulted if I'm comatose or whatever. Is there any consideration for that? But I did understand you that, yes, I could bring bottled pills with my name on it prescribed in a 30-day supply into the health center with me. And then we could start, I think they gave me a whole month worth of pills, or 90 days, I guess it was 90 days. So I had a lot of pills that I...
Yes, ma'am. I feel like we have come a long way in the health center, particularly in the realm of pharmacy and medications, and I'm very thankful to Neil partnering with us. I wish I had brought the medication, the new roll, the packaging system that we're using now. As you said, you'd been here in the health center a few years ago, and if some of you have been there before, you remember that the medications come on a card. It's a punch card, a bingo card, they call it, and you go home with a huge shopping cart full of it. It's wasteful, it's expensive, it's hard to read, and you're trying to figure out how to manage all of that. So we have fixed that. So we no longer have it in these big cards. They are on a roll, and they are dispensed to us every Thursday night from Neil, and you're only getting 1 week supply. It comes in it's almost like a pre-pour, they call it. It's a pre-packaging. So let's say you take something at 9 a.m. and you don't take anything again until supper time. It's packaged for us. So that helps with the waste, and it helps with transferring back over to your bottles if you're used to that. If you, if you have a medication that gets discontinued, you don't end up with 90 of them. Also, if you have medications that you just use periodically here and there, we can put it on the profile, but not necessarily fill it. And that is on us in the health center to communicate that to Neil, to the pharmacy. Because if we have an order and it gets sent to them, they actually can't read our minds that we don't want it sent unless we tell them. So it's on the nursing staff to let them know. Neil's been really good to us to work with us, and oh dear, I got this medicine, I shouldn't have ordered it. And so they've been really good with us to help, change that around as well. But at the same time, once it leaves the pharmacy, it really is on us. We should not expect them to reimburse it, just like if I go to Walmart and I get a prescription and I leave leave Walmart and I'm back home, I really can't bring it back and get it reimbursed. So again, Neil's been really good to work with us, but it's on nursing to do that. But just communicate that either to the clinic when you come in or to your nurse when you're there. Hey, I have these 3 medicines that I use as needed. I don't want them filled. And we will work on that. And you've got my information too. I'm always willing to meet with you and help you with that.
You do have a little, you don't get the 90.
No, ma'am.
You do have some time to work for this.
Yes. Yes.
Right. Oh, that sounds.
Yes, ma'am. It's been really good. I mean, Steve said that well, that we really do look at you all as our moms and dads and what we would do for our parent. And it would be really confusing to send all that stuff home, and it's wasteful, and we're mindful of your dollar too. So we want to make sure that we're taking good care of you and your resources.
Oh, okay. I wanted to ask about personal things, like when you're in the healthcare center and you need to have your clothes washed. Do you hire somebody to come in and do that, or how does that work?
Yes, ma'am. So you can hire home care to come and take care of that for you. Some people will have a family member come. Some people have, some of our CNAs will individually wash someone's clothes for a fee if you would like. I would say the easiest really is either a family member continues or home care, and they can do that. It's a 2-hour billing cycle. So you may choose, hey, every Thursday I'd like y'all to do my laundry, and maybe they can come in and do some other things too to fill up that 2 hours of time, but they would take care of that for you. Yes, ma'am.
Debbie, can you just talk real briefly, because it comes up a lot, about after-hours admission to the health center and kind of that policy?
So Brad asked the question, what is the policy, or how do we handle when there is an after-hours admission? So of course, 8:30 to 5, when the clinic is here and we have an admission from the clinic or from the hospital setting, that's pretty a routine piece, and we've got that. That tire is pretty good. It's a well-oiled machine on that piece. What happens is after hours. So after hours, if you come in, let's say Thursday night, you're not feeling well, and you're at your apartment, and you've called 0, as you should, and the nurse has come to see you, and you're very wobbly, or maybe your knee is swollen, or maybe there's concerns, or there could be something going on, and you really need someone to be watching you in the health center. You're not really safe or stable to be at home. If we were to just bring you into the health center, you're not going to see somebody because, let's say Friday, maybe Miss Ann is off for the day, a planned vacation day. So you're not going to be seen Friday, Saturday, Sunday, Monday, not till Tuesday. And we don't really know what's going on with you except I don't feel good. And if there could be something quite serious going on with blood work or a chest x-ray, something that you need. So I know it is a super big hassle to go out to an urgent care or to the hospital setting, but my nursing is relying on what to do for you for your best care. And if there's something really serious going on, it would behoove us to make sure we know what's going on. So again, no one wants to go out to the ER or an urgent care, but that's now the policy because we really do need to know what is going on. You've got to be seen by a provider so that we understand, is your blood work way out of whack? Is there a pneumonia going on? Something that you need help with. So again, we're trying to weigh out, it is an irritant maybe to have to go out to get checked out. But, we need to make sure that we know what's going on with you to be able to treat you and care for you versus just bringing you breakfast, lunch, and dinner and your pills. We need to make sure that we're taking care of you. So I hope that answers that question. Any others? These have been great, and you can ask anybody else questions as well.
My question just kind of follows up on yours, and that is, if we need to go out, like if I have, my arm like broke or something like that, and can Jane just take me to an urgent care? Do I have to connect with you at all? Or how does that work? Or should she let you know and then we go?
Yes, either way. I mean, you're living independently. If you feel like my arm is not right, I need to go to an urgent care and get it x-rayed or whatever, absolutely. And then if you would need to come back for that, this happens too where someone might go to the hospital or urgent care and there's a problem, but the hospital says, this is the problem, but you can go back home. And then through the night or later on, wow, it's too much, I can't handle this on my own, you can come into the health center at that point. You don't have to go back to the doctor again, because we already know what the situation is. It's only if all of a sudden you have some terrible vomiting or something, and we don't know, is there something quite serious going on, or do you just have a stomach bug? So we really do need from the provider what's going on.
Just to make sure I'm covering your question, we do want to know either way. Even if you have a friend drive you, let us know so that way the clinic can check up on you. Or let's say you go to the doctor and they say you do need to go to the health center. Well, the health center will already know that something's going on, you went to get checked out, so they can kind of be prepared that you might come back. We always like the information. You call security and they'll direct you to whatever nurse is covering at that time.
I guess this kind of follows up on that, but it's been my understanding previously that when, like, if you send us out, like if we fall here and you send us to the ER, that there is a healthcare record or a cover sheet or something that goes with us. If we get our friend to take us, we don't have that information and can't send it with us. So what do we do in that instance? Just go without it?
That's a great point. We have access to that 24 hours a day. So if you have a family or a friend lined up that you want them to take you, you can still do that, but you could even just stop into the health center and we can print you out that information. And that way the clinic is aware as well, because we communicate with them so that they make sure that they're tracking and making sure that they're doing the best for you as well. But you can get that formalized paper, even if you have a family friend or someone taking you. The health center, or you can just dial 0 and just say you need to speak with the nurse. They'll transfer that to the nursing supervisor on duty, even if it's 2 in the morning, and they'll get that handled for you. Yes, ma'am.
Coming.
This is a very simple question. When you're discharged from the health center and go home and that you are sent your meals for 5 days, is that 3 meals a day or is that just the evening meal?
Good question. That's one meal. One meal.
1 meal.
Yeah, once a day. Yeah.
So somebody.
There's no charge for that.
Yeah. Okay. Thank you.
You could, have an additional, but there'll be a charge, if you have, for that second meal. Yeah, you're going to call the dining room. Yeah. After the 5 days of meals, if you need, around that time, if you feel you need an extension for more meal delivery, you could call the clinic and we could get another order for another 5 days.
Still for 1 meal a day?
It is, yes, yeah.
Okay. If something happens in the middle of the night and you want us to go to the ER and there's nobody else to take you, do you arrange for somebody to pick us up?
Yes, ma'am. If you had to go to the emergency room in the middle of the night, we would be calling an ambulance to your apartment, and they'll transport you over. Yes. And we will get you back home too. We will not leave you at Rex in the ED or at Wake Med or Duke Raleigh. We'll make sure you have a ride home as well. And we do contact your family so they're aware.
Hearkening back to my couple of years ago, I think I had that, I call it the board meeting or the parole board meeting to
Is that a care plan meeting?
to get out.
To get out. Okay.
The timing, I couldn't get anybody to answer me on the timing. I was waiting for surgery, and so it was a little more complicated. But now, if I went up there, as I understood, we would have a care meeting if I'm able. I mean, obviously, if I'm really flat on my back, you probably wouldn't. It would be obvious I needed to stay up there. But after two weeks, having seen Patel earlier, I saw him when I left. Never saw him initially. And then, if it's determined that I would have to stay, is there another set timing? Is it another 2 weeks then? Or do they assess a little earlier? Because hopefully you're having the therapy and all of that is ongoing. So maybe you're ready to go in the next week, not another 2 weeks. Or how does the timing work on that?
Yes, ma'am. So we're mindful, of course, of your E-days as well, your eligible days, those freebie days, okay? So let's say you come in for, it's random, you're in for cataract surgery and you need help with some eye drops for a few days. You don't have to wait 2 weeks to discharge. They will send you information that there's a formalized meeting, which is dietary and nursing, therapy, social work, many pieces, but you are not locked into the health center for 2 weeks if you're not needing it. Some people come in just for a short time and will not even do that care plan. The care plan again, it's not a parole. They're not gonna keep you locked up forever. But the goal is to just kind of discuss where you're at. Usually, that is for someone who's been here. God forbid you break a hip and it takes a while, so you're going to be there longer than a 2 week period probably. But then they are meeting again actually in 90 days. Now, there is a lot going on already behind the scenes, but there's a formalized meeting at that 2 week, and that's regulated by state. So again, we would come, Steve would come, I would come, the nursing supervisor would come and discuss and say, hey, you're ready to go home now, and these are the things what are your goals, and what is the setup for you? So you don't have to do 2 weeks and then wait 2 weeks and wait 2 weeks and wait. It doesn't work like that. So, and again, the goal is to get you home as soon as you're safe and able to go home safely. So 90 days is usually for a resident that we have with us now that stays with us long term. And we meet with the family or with the resident every 90 days, quarterly is what we meet with. And you don't have to wait that long if there's a concern. We always discuss that prior to, but it's a formalized set of times so that we know that we're meeting with the families and the residents and making sure that you are dictating your care as well and that we're all on the same page to help toward that goal. But for short-term residents, it's that 14-day, and again, you're not stuck for 14 days. It is just a formalized plan. Many of residents don't even stay that long, and so they're gone before that time frame. But that gives us time to review your whole case to make sure we're doing everything we can, that the physician has seen you, and the therapy has some sessions that they can give us direction on how you're doing. Good question.
Going back to the question about being sent out to the ER from here, I'm fairly certain that when I came here, I was told by my marketing person that if you were sent to the ER by ambulance and did not have a family member present to go with you, that somebody on the staff would go with you until some family could get there. Is that still a policy?
No longer. We used to do that, but then when COVID hit, they no longer allowed that in the ER, and so that policy went away. So we do ahead of time. We call the ED and explain what's going on, so they know what's going on. But there's not someone from Springmore proper that's sent with you behind the ambulance. They do have social worker and others that are checking up too, the chaplains and others that are seeing the residents in the health center or in the hospital setting.
Is that it? All right. Well, thank you so much for your time. They might be here for just a few more moments if you have something on the way out, and have a wonderful day.